well, back then, because this was back in the 90s, And so I don't know if people talk about how they're really coping with it. You just know you have to figure out a way to make it work for you to get through each day. So sometimes for me, I liked very, very sick patients. And
Why?
usually because they couldn't talk.
Wait, that sounds crazy.
I know.
You preferred the patients that couldn't talk?
That couldn't talk because my passion and my goal was always saving lives. So if you talk, that slowed me down. The family members slowed me down. I just wanted my 12 hours to keep you alive and save you, because that's what critical care nursing is. It's like once you come out of surgery, it's always trying to figure out this puzzle and what's going on with the patient. So very simple things mean a lot, meaning paying attention to what you see on the monitor. If you are able to talk, listening to you, because those little words can mean what's going to be coming later. Oh, I just feel, I'm a little nauseous, no big deal, that kind of thing if they're talking. And you're paying attention and something down the line is about to happen. Some of my patients that did do that code blue, for the lack of better words that we're going to call it, some of them I knew that something was going to go wrong. Because I'm paying attention, I'm like, I can't figure out what's going on with this patient, especially surgical patients, because they come out very unpredictable.
Has there been a circumstance in which you could accurately predict what was going to happen with a patient and you tried to alert a doctor and they shut you down?
Shut me down so much so in nursing you have to document, in healthcare you have to document heavily. But there's a such thing as over-documenting, because you could easily be in a lawsuit just from over-documenting too much. There is a such thing as too much. I know you're like, what? But yes. So you document enough. They actually teach you how to document. And I remember getting a report and I'm thinking, why aren't we doing XYZ on this patient? Because they seem sicker than what I'm really getting. And to basically make a long story short, I watched this patient just deteriorate hour by hour. And I'm doing all I can. I'm calling the doctor. No one even came. I'm just getting all these, back then you could take more verbal orders. And so I would get all this stuff and I'm documenting. The one moment that I didn't write, MD notified, that was the knife in your chest right there. Because I fought everything to keep this man alive. And guess what? He ended up dying. Dying on Christmas. The worst, if you can't take that personal and that pain and know that you could have done more, but you had this doctor that wouldn't listen, and guess what? I got blamed for it. I got blamed for it. So that's why, and that leads me to why did I leave nursing? As much as I loved it, I really got tired of covering some not every doctor is bad, but some of the doctors.
So people want to know the tea. They listen, there's a reason why medical procedural dramas are as popular as they are.
Yeah.
People like to watch the drama. Everybody walks into a hospital and says, so are the doctors sleeping with the nurses? What's happening here? Is it super mixy in this environment? People want to know. But they are also curious about, what happens behind the scenes. Doctors and nurses, they show up as professionals, but that the second that they get out of earshot, they're talking shit about somebody. So what are some of the things that, just made you decide, that's it. I love critical care nursing, but the environment itself just does not work for me anymore?
It was a couple of reasons. The first one was I got tired of covering their butt. It's when it all else fails, it feels like it's always the nurse's fault, never the doctor's. The hospital invests more in doctors than nursing, right? So that was one. And then the second one was it can be a very catty profession. And
how so?
Oh my gosh! So,
I mean, because here's the thing. Look,
because I'm still a nurse, and I love it. But
before you finish your statement, Dr. Somi Javed sat here and we talked a little bit about competitiveness amongst women in a professional setting, and so it's interesting for you to organically just bring that up. So I'm always going to ask about that because it's fascinating to examine female dynamics in different environments.
Yeah.
And so you say that in the nursing profession, there is an element of cattiness. And so expound on that a little bit.
I think it's just I think it exists with any profession. You've got coworkers. It's competitive. You got jealousy, and you got.
And how does that manifest? Like, what is the behavior like?
The behavior is like. So it depends. I work for a union hospital, so you can write each other up, and you can write your managers up, and things like that. So you can get somebody that's trying to report you for what they perceive as something you shouldn't have done, or something like that. It's just assigning you the worst patient every time. And you can tell they're just taking something out on you. You know what I mean? So it's just always this little, I didn't make, my colleagues were never my friends. This is the first profession that I went into in terms of being in the medical device industry, where I actually
have developed some friendships.
But as a nurse, I never hung out with my colleagues after work or anything like that because, and this is going to sound bad, I knew it. I wanted to be able to go to work the next day, and if I had to curse you out, I would.